An estimated 50,000 to 70,000 children live and inevitably work on the streets of Metro Manila. How can you help get them off the streets for good and change their lives? This morning, we put the spotlight on philanthropies, whether it's corporate giving or personal advocacies that ensure better, longer lives for these children, the foundation of our future. Childhope Philippines Executive Director Dr. Herbert Carpio joins us live this morning. Hi, Dr. Herbert. Good morning. Thank you so much for taking our call.
Good morning, Mimi. Thank you so much for the invitation. It's our pleasure.
I wanted to begin by asking you, how did Childhope begin? I know it was set up in the 1980s, and in 1989, a regional office was set up in Manila. And now, when the international unit closed, it's Manila that actually stayed. So tell us more about Childhope Philippines. What do you guys do? And more importantly for our viewers, how are you, who's funding? How are you funded and how are you regulated?
Okay, so Childhope Philippines, as you said, the regional office in 1989 was established here. Just because that was during the economic boom all over the world. However, they noticed that the people, especially the children in these developing countries, have been left out. So the economic boom, the progress doesn't trickle down to the grassroots level. So the founders of Childhope continued the work with children in street situations and their families here in Metro Manila. Actually, as you've said, we are the only remaining Childhope unit that is existing until now. So we've been around for 34 years already. And thanks to the support of grants and donations from our international and local partner organizations.
All right. And what have been some of the most notable gains from your programs? Do you have some standout stories you'd like to share with us?
Actually, we've served about 10,500 children in street situations already. Our mission is to promote and protect the rights and welfare of children in street situations, or the street children, through direct integrated services in education, in health, in social welfare, and skills development. And we're very happy and we're very proud that a lot of these children have already turned a leaf. And several of them have been contacting us. We've already been out of the streets. We're now working in a company. We've had children who are now working abroad, traveling the world. So it's very heartwarming that they get to credit the success that they are experiencing right now to the programs and services of Childhope and its partners.
And hopefully when they make it big, they can also contribute. Dr. Herbert, the main topic of today's discussion is actually about this special project where you use rap songs, music, to help kids focus and learn the lessons faster and better. Before you talk to us about this, we have a video, and let's watch this first.
Everybody, kamusta kayo? Mag-practice muna tayo ng English dito. Simple lang naman ang hinahangad ko na lahat ay makausap nyo. O, simulan na natin ha? How are you at kamusta ka? Good morning ay gandang umaga. I'm sorry ay pasensya na. Don't worry ay wag mag-alala. Ang dali lang, diba?
So we all know, Dr. Herbert, that music activates both the left and the right hemispheres of the brain, activating both, maximizing learning and improving memory. But tell us about this project. So you go around, the streets of Metro Manila with this karaoke to use rap songs. Why rap songs? And what's the impact?
Actually, we have what we call the KalyEskwela Mobile Community Learning Hub. It's a van which has audiovisual equipment which we bring to the streets. It's an innovative way of teaching children about alternative education. And these rap songs, they were conceptualized because we've noticed that children learn songs faster and they don't. They tend to remember the lyrics of songs. And with the street children, actually, their most loved genre are hip hop and rap songs. So, with the collaboration with our partners, our longtime partner BBD Guerrero, with Hit Productions, several independent musicians like Meg Saludes, we've conceptualized this singing lessons, which are actually a collection of 15 songs with topics on children's rights, multiplication. We also have topics on health and hygiene and our national heroes. So these are things actually that sometimes the children get difficulty in learning. So with incorporating these lessons and teaching them through rap songs, they get to remember them better.
That's good to know. But beyond, with this kind of project, your Mobile Eskwela, and even beyond it, what would you say, Dr. Herbert, in your experience as Executive Director of this organization, are some of the biggest challenges facing children in the Philippines today? Aside from education, when you're out in the streets, it's so noisy, it's so hard to focus. That's why you came up with this. What else? What are the other challenges?
Well, actually, as I've said a while ago, although the economy has gotten bigger, progress has not really trickled down to the level of at the grassroots. So it's still poverty that is the biggest challenge. Education is getting higher. However, there are several other challenges in education itself, because it's not just going to school. You have to provide for food. You have to provide for the materials that the children will need during their learning. So these are associated with nutrition, with challenges in health. So those are things where 24/7 they are exposed on the streets. So they are very much exposed to the hazards, and a lot of them has health problems. And this also affects how a child is being educated.
And how effective do you think are Philippine laws at protecting the rights of these kids, rights that have been outlined in the United Nations Convention on the Rights of the Child? Do we have enough?
Children's organizations like us are here to be vanguards. So we always push for putting the rights and welfare of these children who are being neglected by society into the forefront. So we encourage the discussion, we encourage them being in the limelight in social media. So these are things that we help with in pushing the agenda of children's rights forward here, especially in our country. So we also are very active in networks that push for the passage of laws for better social welfare services, especially for children.
What do you think is the most urgent, Doctor? What do you think is the most urgent policy reform that you need to see for these kids?
Actually, what we want right now to see is the integration of education and economic opportunities, because this is one of the most proven tracks, wherein when you get to have a stable job with the parents or the relatives or the guardians of the children would have sufficient income, it helps them to get their whole family off the streets and for them to support the education and welfare of the children.
All right. And finally, I wanted to end with this, because many of our viewers are probably big donors as well. There have been reports that in many parts of the world, we're seeing a reduction in international development assistance in general, which once played a pivotal role in maintaining public health and education systems. Has this been your experience in the last 3 years? Has it dealt a severe blow to your ability to implement vital programs? I mean, you did say during good times, hopefully even during good times, the benefits don't trickle all the way down. But what about during bad times, when you're looking at high inflation, high unemployment, very volatile economic conditions, and a slowing economy? Are you starting to see donor fatigue? Are you starting to see a bigger pullback in donations?
You know, Mimi, surprisingly, even during the pandemic, more and more companies have been reaching out to us because they wanted to help. They just needed organizations like us to provide them the opportunities. In fact, during the pandemic, we've had a lot of support. We were able to raise enough funds to help more than 4,000 families being sustained for the past 3 years. Okay, so that is, and I think more and more companies are realizing that it's not only, it's also their responsibility to be able to help the communities where they are working. So I think that is a very good development in terms of corporate social responsibility activities.
That is good to know. On that note, Dr. Herbert, thank you so much for joining us and for sharing this good news and exciting projects that you have. We hope to hear more great stories from your group. See you soon.
Thank you. Thank you very much.